Since 1987, during the HIV/AIDS crisis, the Poverello Center, Inc. (TPC) was founded by Fr. William Bill Collins. The goal of TPC was to provide nutritious food to people who were rejected by society in large numbers with complications from HIV/AIDS, with little or no thought for their continued mental and physical well-being. Due to the stigma of the disease, the urgency to provide health and social services to dismantle structural heterosexism and combat stigma was evident. By caring for LGBTQIA+ people since the beginning of the HIV/AIDS crisis to the present day, and conducting surveys, TPC decided to utilize an evidence-based model of food as medicine to promote healthier choices for program participants. TPC has been at the forefront of promoting lasting changes in policy, systems, and financing that improve community conditions. Through gaining resources to show love to those who at the time knew little hope, TPC reached people who were otherwise left unaided. In a system without expertise or solutions, at the time this unknown virus was discovered, in people who were wasting and focusing at the time on allowing them to die with dignity. TPC utilized funds from 2 social enterprising thrift stores, which enable us to strive to combat fear, stigma, structural racism, and isolation through the richness of community engagement, involvement, education, working in partnership across sectors, providing food as medicine, linkage to care, to address structural injustices, advance opportunity, health, equity, and bring purpose into the lives of clients, often hiring from our program participants. TPC has approximately 3,500 program participants with a large percentage of BIPOC. 35% are African American and 35% are Hispanic, who are receiving medically tailored groceries, MTG, and medically tailored meals, MTM, a year, with an average of 450 to 500 new clients annually, having served an estimated 26,000 clients to date, thus striving to end the HIV epidemic. We now provide food as medicine to people with cardiac and kidney problems, as well as those with glycemic disorders, cancer, or other critical chronic illnesses. Each year, nearly 5,000 South Floridians needing support come to the Poverello Center, Inc. to select medically appropriate grocery items from our specialized menus and receive key nutritional information from our nutritionist. What are food and nutrition services, FNS? Food and nutrition services include medical nutritional therapy, MNT, and the tailored food that accompanies it. MNT covers nutritional diagnostic, therapy, and counseling services focused on prevention, delay, or management of diseases and conditions, and involves an in-depth assessment, periodic reassessment, and intervention provided by a licensed, registered dietitian nutritionist outside of a primary care visit. Medically tailored food encompass home-delivered meals, congregate meals, grocery bags, food pantries, and necessary to the fulfillment of MNT. First, we are committed to ensuring and expanding access to food and nutrition programs for people living with HIV through the Ryan White Treatment and Modernization Act. Second, we are working hard to incorporate food and nutrition services, FNS, for people with severe illness in the major programs of the Affordable Care Act, ACA. Becoming part of the Food as Medicine Coalition, FIMC, in 2014, TPC provides medically tailored groceries, MTG, and medically tailored meals, MTM, through doctor referrals, which have been shown to improve health outcomes among individuals with various chronic illnesses, including cancer and HIV/AIDS. The tailored aspects allows for nutritional needs to be met, which is essential for managing chronic illnesses and improving health-related quality of life. TPC feeds over 3,000 a year, medically tailored groceries meals, MTGM, of which 300 are people living with HIV/AIDS, PLBHA, supported by TPC for at least 15 years. Gildas Club, referring program participants diagnosed with cancer to the various services, providing medically tailored groceries and meals. TPC share our knowledge, provide nutritious food for critically chronically ill clients, and elevate the expertise and solutions due to our firsthand knowledge and experience of inequalities being addressed with Gildas Club South Florida and South Florida Transgender Medical Consortium, while making the most of available resources to ensure the effort can endure over time. Healthcare needs of transgender, gender nonconforming, and gender creative individuals.